will really concentrate in the topic that you see currently in the screen, disability inclusion in the health sector. What are the global challenges? And reflecting on these global challenges in disability inclusion, it was actually very straightforward to come, what are those? Because actually the three main challenges of disability inclusion in the health sector are the three main challenges, the three main health challenges that humanity has today and has had already for a long time. And that is that everyone benefits from universal health coverage, that everyone is protected from health emergencies, and that everyone enjoy better health and well-being, or the highest standard of health and well-being. When we translated these challenges to the field of disability inclusion in the health sector, we can frame it in form of three questions. First, how we can ensure that persons with disabilities benefit from universal health coverage, how we can ensure that persons with disabilities are better protected from health emergencies, and how we can ensure that persons with disabilities enjoy better health and well-being. And it has been very clear already that we need to make sure that persons with disabilities are better protected from health emergencies. That is what has been the accent of the previous talk. And we also put very frequently the accent on benefiting from universal health coverage, and that will be also the accent that the next talk after mine will concentrate on. And I want also to say that even if now we are in the middle of this pandemic of COVID-19, and we see this second global challenge as essential, and also the one of universal health coverage, we cannot forget that still there is a global challenge when we think of public health interventions that are not delivered by the health sector, but that has the main objective of improving population health. The most clear of those is access to water and sanitation, for example, where also disability inclusion needs to be a main objective. Even if these three global challenges are so clear, and actually I would even claim that has been so clear for such a long time, what puzzles me is why we don't get this job done, why we do not move forward with this agenda, even if we have a very clear common vision that is rooted in the Convention of the Rights of Persons with Disabilities, in the clear vision of equity and equality, even if there is a political commitment in countries at the highest level of the government that is demonstrated, or it is demonstrated through the ratification of the convention. And even if we know what are the barriers that persons with disabilities face in all these three global challenges, and what are the actions that we need to do to address them. So how can it be that these challenges are not addressed? And the claim that I bring today to all of you is that this is because there is two fundamental challenges that are underlying three global challenges. And the first fundamental challenge that I would like to bring to you is that there is still a lack of evidence-based technical guidance. In order to make sure that disability inclusion in the health sector happens and it is a reality. And I would like to bring 3 examples of this in the 3 really global challenges: universal health coverage, protection from health emergencies, and enjoying better health. When we talk with ministries of health, and ministries of health are willing and committed sometimes to move forward with the agenda of disability inclusion. And they are, for example, negotiating and planning what is the budget that they need to put together in order to provide with quality effective interventions, or a set of quality effective interventions to the whole population. The question that we receive is, okay, if I want to do it in an inclusive manner, tell me exactly what are the actions that I need to do very concretely and that are effective, and tell me how much it costs. And we need to recognize that still we cannot answer these questions in a concrete way. I would like to put another example in terms of health emergencies. We have today the guidelines of inclusion of persons with disabilities and humanitarian action. And WHO has also been part of the development of these guidelines. I have given these guidelines to my colleagues of the emergency cluster, and they come back to us and they say, you know, this is an extremely important document. It is a great document, an advocacy document to really make the case that we need to include persons with disabilities in humanitarian action and actually in the health emergency or the health emergency response plans and preparedness response plan. But still, what I don't get is what concretely I need to do and what will effectively work. And the third example that I would like to bring, also related to the discussion with colleagues in the health sector and colleagues at WHO. When colleagues at WHO wanted to move forward with global recommendations of physical activity with health, the question was very concretely, what evidence-based recommendations can we include to make sure that these recommendations are inclusive of persons with disabilities? And even if the evidence is out there, we didn't have a very straightforward answer to this. So the claim here is that we really need to move from advocacy to action through evidence-based guidance in order to overcome the global challenges that we are facing in terms of disability inclusion in the health sector. The second global challenge that is foundational to the other global ones is that still disability inclusion is not a political priority in global health. And we need to recognize that it is not a political priority in ministries of health. But still, most of ministries of health will answer us when we move forward with the agenda, we approach them with the agenda of disability inclusion. The answer is, sorry, disability inclusion is not under Ministry of Health. And that is something that fundamentally needs to change. Because we need to make disability the agenda and disability inclusion the agenda of every Ministry of Health around the world. So summarizing, there are 3 global challenges for disability inclusion. These three are really the challenges of including disability in those global challenges in health of humanity. But there are two fundamental challenges that are specific of the disability inclusion, and that we will need to tackle in order to tackle the more general ones and global ones. And this is the lack of evidence-based technical guidance and not disability inclusion not being a political priority in health and in ministries of health. The good news is that we have opportunities. And I will elaborate now only in two opportunities. I will elaborate a little bit more on this and other opportunities later in the morning in my second talk. The first, and these two opportunities that I would like to mention now, I have summarized now with the words first, recognition, and the second, partnership. In terms of recognition, I think that we have now really an opportunity because today we are not there where we were 10 years ago in terms of the recognition, especially of the disability community, that disability is a health issue. Today, we can openly say that disability is not only, but also a health issue, without this meaning that we are going back to the medical model. And I think this recognition is fundamental in order to move forward. The second recognition that we can bring forward openly is that there are impairments and primary health conditions underlying the disability, and that this does not imply any value judgment about the individual. Impairments and health conditions are universal and part of the human condition. And the third one is that the recognition that we have been facing constantly, as the previous speaker was saying, that persons with disabilities are particularly vulnerable in a public health crisis like COVID-19. And this is an important recognition that provides also a window of opportunity to move this agenda forward. The second, in terms of partnership, that it will be fundamental to move the agenda forward, and it is a huge opportunity that we have today, that I think, again, we are today in a different position as we were 10 years ago, is that disabled people's organizations are equal partners in moving disability inclusion forward in the health sector. And we are equal partners, DPOs are equal partners with the health sector. A symbolic demonstration of that is that for the first time, actually, IDA, that is an umbrella organization of disabled people's organization, are closing a collaboration agreement with WHO in moving this agenda forward. So we have big challenges, but we have also big opportunities that will contribute, and there is no doubt that we will get the job done, and the time to get the job done is now. Thank you.